Hi, my name's Rachel Bullock. I'm independent nurse prescriber and trainee AMP for CAMHS at North Staffordshire Combined.
Hi, my name is Ann Cox. I'm CAMHS consultant nurse and clinical lead at North Staffordshire Combined Healthcare.
And this presentation is the transformation of ADHD management in alignment with primary care to support our abstracts to the Mental Health Nursing Conference 2020. So when we look at innovation and shared care and understand kind of, the history around that, it was first developed in 2007 and locally it was really slow to develop. And some of the reasons around that were kind of poor relationships across primary and secondary care, kind of not understanding roles and responsibilities of shared care agreements and where responsibilities sit. A real lack of confidence from primary care practitioners in how to take over the management of some of these long-term presentations, and really an ability to kind of send that out to primary care, not retain, was a problem as well. So we really need to address that as senior clinical nursing roles. So we set about kind of developing a shared care model, which is award-winning locally within our trust.
In terms of the value and impact of shared care, what we managed to do, certainly in the initiation stages of this, was from June 2017 to June 2018 was increase the amount of shared care agreements by 85% within our service. This now is well over 100% of where we were at in 2017. So this further has had an impact on the whole service capacity by increasing it by over 25% now, which obviously impacts on those other children and young people without neurodevelopmental disorders or comorbid neurodevelopmental disorders, getting an increase, better service for that. We've also managed to recoup £52,000 over the last year from the change in FP10 costs, and what we have done is reinvest this in the ADHD pathway by introducing the QB technology, which again has enhanced our pathway. Overall, we have calculated that the savings within our service are approximately £543 per child per year. And when you consider in 2018 there was 75,000 children prescribed ADHD medication, there's a possibility of saving somewhere around £40 million per year. And if you add that up over a lifetime of savings, you're looking at nearly £500 million.
So if we look at patient focus and the evidence around why we needed to change, certainly within our services, there were long waiting lists for children coming through for ADHD assessment. And on average, families were waiting around 18 months to move through an assessment process, which was way too long, we felt, as nurses, and we needed to do something about that. So part of our pathway was around improving access to assessment, but also improving the time scale of when we did that. So it's much more efficient and focused now, and we seem to work to a 0 to 12 week assessment process with an outcome at the end of that, which we are achieving. Our care bundle on our ADHD pathway is transparent, and that is available to families really coming into service, so that there's some clarity around what to expect through the process, and that's been really helpful. Like Anne mentioned, we've been able to reinvest our costs from the medication that is now being prescribed under primary care, and we've reinvested that back into our efficiencies and assessment processes on the pathway. We've also increased our non-pharmacological treatment options as first line, so medication is further down the line, or for those with moderate to severe symptoms. We do have a strong MDT work embedded into our pathway, and all decisions made in terms of assessment and diagnostics are under an MDT based approach now. So we're much more confident when we reach diagnostic decisions and clinical decision making as a result.
In terms of collaboration, we've been collaborating with a number of partners during this journey. These are just a few. So obviously within our own trust, we've also been working with our adult services to try and improve the pathway and looking at transition. We've been sharing our work with Healthy London Partnership and also with the East of England clinical networks. ADHD Foundation have also been very supportive in ensuring that our pathway meets best practice and is also patient focused. We've been working with our local groups. We've got Pegasus, who is our parent engagement group, and also our youth council as well, that have been helping us in trying to develop the care bundle into a two-way facing document. In terms of clinical effectiveness, some of this has already been referred to, but essentially patient experience is the primary efficiency, really, in terms of they're not having to come to CAMHS for everything. They can go to their GP. Some of the feedback that we've had from children is that this is far better for them. People don't know why they're going to their GP, whereas they do for CAMHS, and it's important that they have that autonomy of getting their medication where they feel most settled to get it. Building our relationships with primary care has established enormously, to the point where we've now got nurses within the primary care bases working side by side with the GPs. We've improved our efficiency of the pathway. We've got safer prescribing practices, increased capacity that we discussed before, an increase in non-pharmacological interventions. We've also got significant cost improvements and cost savings, which is important all round. And as we said before, it's approximately £543 per head, which is around 40 million nationally, and with a possible saving of nearly £500 million on a life saving.
So when we look at our nursing roles and how we've kind of developed and championed our leadership skills and our advanced practice within our trust in 2019, we were successful at winning our Trust Team of the Year. So that was for our Nurse Prescribers and advanced practice within CAMHS for developing the ADHD pathway. But we also collaborate with Positive Practice in Mental Health as part of the work we do, and more widely kind of sharing that. And in 2019, we were the winners of their Partnership and Co-Production Award, again for the work we do alongside primary care and the development of those CAMHS clinics that we're setting up in GP practices locally to meet the needs of our families. We have spread that wider, and we have been shortlisted in 2019 to the Nursing Times Awards for the work we've done. And we're also happy to share wherever we can more widely, so other services we can share the work we've done and how that could be developed further nationally.
In terms of adaptability, absolutely shared care in our ADHD pathway can be delivered nationally. It's very transferable. We're also in conversation with NHSC about development of a national strategy for neurodevelopmental disorders, because at the moment we don't have one, and we really do think that this could be one of the core structures really that can support that pathway. And I think care bundles as well, they can be adapted to other disorders across many services. The increase in social prescribing has to be helpful, moving away from that medical model and thinking about how we can help young people without pharmacological treatment. But that's not to say that, it is important that pharmacological treatment is available for some that need it, and also developing a more manualised approach for CBT for ADHD, which isn't widely available.
And sustainability, I think nurses are ideally placed to ensure that innovation continues, and we're continuing not to stand still and learn from what we're doing, to evaluate services and to push that forward with new guidance and new evidence as it comes through. Empowering other staff as part of the MDT to change that culture to develop further and to champion senior nurse roles in mental health, and also to develop more widely in shared practice.
In terms of the achieved outcomes, what we've done is we've managed to develop an effective and sustainable ADHD pathway whilst building relationships with primary care. It's co-produced, patient-centred and aligns with all the CAMHS national drivers, especially the long-term plan. You know, we've championed nurse-led innovation, and that's not been without its challenges. We have had to work through adversity, and changing cultures is not an easy thing to do, but we have done it and we're very proud of what we've achieved. And the cost savings speak for themselves, really. It is efficient and we can make cost savings from this, so we can reinvest within CAMHS and in children and young people's mental health.
Thank you for listening, and we're happy to provide any questions or more information if needed.
Thank you very much.